I'm Dr. Peter Zelles. I'm a clinical psychologist in practice in St. Paul, Minnesota. I'm also on the faculty at the University of St. Thomas in their graduate psychology program and at the Hamm Memorial Psychiatric Clinic in charge of their psychological assessment training program. Everybody's pretty scared right now with the COVID-19 outbreak. It's a frightening time. A lot of us feel like we don't have much control. There's a lot to be worried about. And I think it's worthwhile to talk a little bit about taking care of ourselves from a psychological perspective when it comes to dealing with anxiety and when it comes to dealing with work. One of the things we're talking an awful lot about these days is social distance. It's a terrifically important concept because it's one of the main ways that we're keeping this virus from spreading too quickly. That distance is important, physical distance, and that's different than psychological distance because humans need to have closeness with others. During the time when we're not close with our friends and some of our family members because we're living apart, it's important that we maintain good social contact with people using technology if possible, like video link-ups such as this, or just telephone. Even letters can be helpful for some people. The one thing we've learned over the last 10 or 15 years about people is that there seems to be one thing that we're set up to do, and that is make contact with other people. If we don't have good contact with people from childhood on, we have more psychopathology, more difficult relationships. So it's important that we're making contact with people on a regular basis, every day. Setting up these video conferences with friends is a great idea. I even hear about people having virtual parties. It's a wonderful idea. Helps us from feeling too isolated during this time. Senior citizens are a special problem right now because senior living facilities of all kinds are limiting access from the outside. That means no one can come in. But also, within those facilities, they're often limiting the amount of interaction between residents, and that causes a lot of difficulty. We've been encouraging senior citizens to be more social for quite a while now, and now we're taking that away. So don't forget those people. If you can teach them somehow to use the technology that you have, or telephone calls, or even letters, that's really helpful. Don't forget those people. Likewise with your neighbors who may be living alone. Try to keep good contact with those people as well. We're dealing with the problem with working right now, of course, also, where so many of us are working from home. And that's wonderful in a lot of ways. We don't have to commute, and it's very simple to do because of the technology that we have. And we're lucky to be able to do that. The problem is it brings on some new special challenges to us to work from home. One of them is that a lot of people end up feeling like they lose their regular schedule while they're working. They lose track of when they should be starting and when they should be stopping. A lot of people feel as though they need to prove in a particularly strong way that they're worthwhile right now. They don't want to lose their jobs. So there's a lot of anxieties around that as well. A couple of things that you can do. One of them I call scheduling normalcy, and that is that you keep your normal schedule that you maintain in your life. If you get up at 6 o'clock while you're working at the office or your job site, do that now. Get up at that time. Do your normal hygiene schedule. Take a shower, get ready for work. If you wear special clothes to work, even though you're not going to that site, wear them anyway. It creates a boundary between work and not work. At the end of the day, when you would normally be knocking off from work, do that again. Stop when you would normally be stopping. Remember that we all open the book every morning and close it every night. We never finish everything every day. So try to schedule yourself and keep that working for you, that you're keeping some boundaries around this for yourself with work. Also, a lot of us are working online. We're doing a lot of things virtually. It's exhausting. It's much, much more tiring for a lot of us than normal kind of contact we have during the day. So give yourself a break about that. Make sure that you're getting recreation time, time to relax at the end of the day. Tremendously, tremendously important for us to do. Because we're not getting the same kind of social contacts at work that we would be having typically, it's important to make those social contacts after work. Talk with your friends, deal with the family, use them. A lot of families are scheduling special activities at home like game nights, things like that. Wonderful idea. Walks are great. Exercise, very important to help you feeling better. If there's one large mental health issue that's on people's minds right now more than any, it's anxiety. People are tending to be anxious who never have a problem with this. And of course, there's a lot of people who do have a regular problem with anxiety anyway, and it's worsened during this time. One of the biggest components of anxiety for humans is about control. We really like control. We like to get as much control over things as we can. When we don't have control, it makes us very nervous. We saw that a lot with the kind of impulse buying that was happening early on in this crisis. People going out and buying lots of toilet paper or water. And we look at those things and say, you know, this is primarily a pulmonary disease. Why are people buying toilet paper? Well, one of the reasons is probably that it makes people feel secure to have these supplies around. The thing is, however, we need to deal with the idea that we don't have complete control over this, and that's always hard for us. We wish we had control over things even when we don't. And one of the ways you can do that is taking stock of what it is that you do have control over. What can you control in your life right now? The spread of this virus is primarily something that happens by touching surfaces that are infected and then touching your face. That's the way almost all transmission happens. There's a little bit of droplet transmission in the air, but that's primarily with medical professionals who are in really high-risk situations in hospitals, and they're doing a great job of controlling that for themselves. Out in the general community, it's happening because we're touching surfaces and then touching our face. So one of the areas of control we can have is this, washing our hands a lot. That's a particularly effective thing that we can do. We should be washing our hands 10, 12 or more times a day. I realize it's turning us all into little obsessive compulsives, but it's an important thing for us to do. It really makes a difference. Cleaning the areas around us that we touch frequently are really important. Those surfaces can have virus living on them. So all of us, I know, are cleaning surfaces as much as we can. The things that we touch on a regular basis, we're cleaning those off as much as possible. The other really important part is trying to avoid touching your face, because that's part of this transmission process. We get things on our fingers and then we get them in our mouth or our nose, even our eyes. And I realize it's a hard habit to break. We do it pretty much unconsciously. We're not aware of it when we do it, but it's important for us to start to move away from that kind of transmission. One of the ways, surprisingly, that works with this is wearing a mask. You know, we've talked a lot about how people probably don't need to wear a mask to prevent getting the virus. It's more effective with people who already have it, unless you're a medical professional where you're in a high-risk situation. One of the things that the mask wearing does, however, is it helps to remind you not to be touching your mouth, nose, and eyes. So getting in the habit of wearing one is kind of a good idea. It can be very helpful to us at this time. Avoid touching your face. I know it's hard, but trying to teach ourselves to do it, becoming aware of it, wearing a mask can really help. So the hand washing, avoid touching your face, cleaning up where we are, and of course, maintaining some social distance between ourselves and others. People are saying right now at least 6 feet, trying to keep that. When we're out in public, trying to keep a kind of a wide berth from people. That's really important. However, that links into the other issue about physical distance versus psychological distance. I've noticed that people out in public are looking very nervous. There's a lot of that happening right now. And one of the consequences of that is that people aren't talking, even a pleasant hello and a smile at each other. The one thing we know is you don't spread this disease by smiling. And in fact, it's helpful for us to try to be friendly and kind with each other at a time when everybody's feeling so anxious. So don't be afraid to say hello to your neighbors. It's okay. If you're keeping a distance with them for a moment or two, there's nothing wrong with talking a little bit and sharing how difficult it is. That helps us. That's part of maintaining social contact. So maintain the social distance as well, but limit the psychological distance. We want to be closer to people. Another area I'm going to talk about is cultivating a sense of gratitude, because it's one of the ways we really deal with anxiety, is focusing on something else. You know, you can't stop yourself from thinking anxious thoughts, but you can start yourself thinking about other things. And one of those that's very helpful is gratitude. I know a lot of people have talked a little bit about how it feels kind of like being in jail, being sentenced into a house like this. But you got to remember, this isn't jail. We're in nice places with good surroundings. We have things to eat. We have things to keep us occupied. It's frustrating, and it's worth admitting that, but let's not make it worse than it is. Equating it with jail is really not fair. People who've really been in jail know it's a lot harder than this. So we try to cultivate some gratitude. Try to find 2 or 3 things every day that you feel some gratitude for. It might be some people in your life. It might be your job. It might be a possession that you have. Maybe you had a particularly great bagel that day, but something that you enjoyed and you felt good about. Cultivating that sense of gratitude helps to equalize our mood. It tends to reduce anxiety. It's a very, very helpful thing that we can do. So I encourage that. We're all kind of in this together. This is the first time we've had a lot of shared sacrifice and shared anxiety for a long time. It probably hasn't been this significant since back into World War II. So this is a kind of uncharted territory for most of us, kind of frightening. We don't need to be scared of each other. We need to be thoughtful about each other. Things that we do to take care of ourselves are also to take care of the community around us. So that's part of the sacrifice. So we're trying to help each other out in this. And that's good for psychological health, actually. It's a good thing for us. I'm going to leave you with one thought, and that is that when if you're being chased by a bear in the woods, about the worst thing you can do is be looking over your shoulder all the time. You want to look forward to where it is that you want to go, keeping yourself on the eye of the path that you want to follow. Where do you want to end up in this? It's a good thing to be thinking about right now. In a couple of months or a year, when you look back on this time, how do you want to have behaved during this time? What were the things you would like to have done during this? Think about that now so that you can actualize that in your life. That's really helpful. A part of looking forward right now is being a little bit mindful about how much news you're watching. If you're watching this video, you're probably pretty aware about the crisis and what you need to do to take care of yourself. Watching the news all day is really just reminding you that we're in a horrible situation and it's scary. Spending hours into the late morning or middle of the night watching the fatality counts from around the world, not particularly helpful. It's not making you feel any less anxious. It's probably not really helping you very much. So check into it a couple of times, see what information you need to have every day. Try not to focus on it all day. That's really not helping you very much. Watch the path where you want to go. So I wish you good luck with this. Take good care of yourself.